Enzymes serve as catalysts for all metabolic processes. They have impressive substrate specificity and stereospecificity, which enables them to fulfill unique roles in health and well-being. To better understand the activities of enzymes as we move through the course, let's look quickly at the 6 major classes of enzymes grouped by catalytic activity. The first is oxidoreductases, and these catalyze oxidation and reduction reactions. These are very common in many metabolic pathways and are coupled with the use of NADH or FADH2 to allow a reaction to move forward or to capture energy. Next, we have transferases, which catalyze the transfer of moieties such as glycosyl, methyl, or phosphol groups, and in some cases the transfer allows for the recycling of a cofactor, and we'll see such examples in the shuttling of long-chain fatty acids across the mitochondrial membrane. Next, we have hydrolases, and these enzymes catalyze the cleavage of carbon-carbon, carbon-oxygen, or carbon-nitrogen bonds. Phosphatases may represent one of the most common hydrolases. What we'll see as we move through these metabolic pathways is that phosphorylation and dephosphorylation is a key regulatory element. Phosphorylation by kinases changes the activity of an enzyme, followed by the dephosphorylation of enzymes by a regulatory phosphatase. Next, we have ligases, and these are enzymes that catalyze the joining together of two molecules, and this is coupled with the hydrolysis of ATP. Next are isomerases, and these catalyze geometric or structural rearrangements within a molecule. Although these enzymes are present in nearly every pathway we'll discuss, they're not regulated steps and therefore will not focus largely on them. Finally, lyases, which catalyze the cleavage, again, of common bonds, and they do this by an elimination reaction, which therefore generates a double bond. So in addition to the types of enzymes, we'll also talk briefly about what changes enzyme activity, or what else is required for an enzyme to complete its function. Two of those major categories are prosthetic groups as well as cofactors or coenzymes. Prosthetic groups, as shown here, are tightly bound to the enzyme, sometimes covalently, and remain associated during the reaction. Shown here is the heme group, which we've also seen when discussing hemoglobin. Other common prosthetic groups we'll encounter are FAD, thiamine pyrophosphate, which is commonly used by dehydrogenases, pyridoxal phosphate, which is used in transferase reactions, and transition metals, which are commonly used in the electron transport chain enzymes. So in addition to prosthetic groups, we have cofactors or coenzymes. The major difference between prosthetic group and cofactors or coenzymes is that cofactors and coenzymes reversibly associate with the enzyme or substrates. These are not bound tightly within the enzyme itself. Rather, they bind the enzyme in a weak or transient manner when compared to prosthetic groups. Therefore, coenzymes and cofactors must be part of the surrounding environment in order for catalysis to occur. To distinguish between cofactors and coenzymes, they're largely categorized as cofactors being made up of inorganic compounds, whereas coenzymes are organic in nature. One of the most common coenzymes we'll discuss in the course is shown here, and this is the structure of NAD+. So across the 6 different kinds of enzymes, we'll note that there are 4 major reaction mechanisms that facilitate catalysis. The first is catalysis by proximity. Enzymes all have an active site where substrates bind, and this helps orient the substrate in a position as well as increase the local concentration of the substrates. The second common mechanism is acid-base catalysis. Within the active site, the ionizable functional groups of individual amino acids can also contribute to the reactions by acting as acids or bases. For acid-base catalysis, these can be specific or general. In specific acid-base catalysis, this refers to reactions in which participating acids and bases are specifically protons or hydroxide ions. In general acid or base catalysis, Reaction rates can be responsive to general shifts in pH. The third type of reaction is catalysis by strain. Enzymes that participate in reactions breaking covalent bonds, lytic reactions, they typically bind their substrate in a conformation that is somewhat unfavorable for the bond targeted for cleavage. This strained conformation mimics that of the transition state of the intermediate, generating a transient species. The resulting strain selectively stretches or weakens the targeted bond, making it more vulnerable for cleavage. Finally, covalent catalysis is the process that involves the formation of a covalent bond between the enzyme and one or more substrates. This introduces a new reaction pathway that requires less activation energy, making it faster. The example of this in your text is the ping-pong catalysis, in which peroxidyl phosphate is used in transamination reactions. Finally, let's look briefly at enzymes of clinical importance. So there are many clinical measurements used in diagnosis that either address the presence or the activity of an enzyme, and there are several examples to be aware of as we move through the course. For most of these diagnostics, blood samples are taken, and the enzyme activity related to liver function, heart function, or bone function can be assessed. This is a summary table of key diagnostic enzymes to be aware of, and we'll discuss most of these in the course. The first, alanine aminotransferase levels can indicate liver damage. They can also indicate levels of muscle damage, as they are present in both the liver and the muscle. These transaminases we'll see when we discuss nitrogen metabolism transfer nitrogen groups from an amino acid to a keto acid. Amylase is a digestive enzyme secreted by the pancreas. It would normally not be found in circulation. In cases of acute pancreatitis, this may be released and assayed for in the blood. Lactate dehydrogenase is an enzyme we will discuss with respect to both red blood cell metabolism and anaerobic metabolism. Elevated levels of lactate dehydrogenase in circulation could be suggestive of either liver or muscle damage depending on the isoform of the enzyme. This enzyme catalyzes the reaction to produce lactate from pyruvate. Troponin is a complex of 3 proteins present in contractile apparatus of both skeletal muscle and cardiac muscle, but it's not present in smooth muscle. Troponin levels will rise for 2 to 6 hours after a myocardial infarction, indicating cardiac damage, and remain elevated for some days after the event. Elevated levels of troponin in circulation would be indicative of cardiac damage. Finally, lipases are also digestive enzymes secreted by the pancreas. Elevated levels of circulating lipase would again be suggestive of acute pancreatitis. Let's finish this with a question. A 22-year-old female presents to the emergency department with acute abdominal pain. She indicates the pain came on rapidly in her mid-abdominal region. Laboratory tests illustrate elevated levels of amylase. This result would indicate a dysfunction in which of the following organs? If we remember from the previous table, amylase is typically secreted from the pancreas. Therefore, elevated levels of amylase in circulation would be suggestive of pancreatic dysfunction. Cardiac dysfunction may be indicative of elevated levels of troponin, whereas liver or muscle damage could be indicative of elevated lactate dehydrogenase, depending on the isoform assayed for, or relative levels of the aminotransferase ALT. Throughout the course, we'll look at these enzymes and how they're used in clinical diagnosis. Keep in mind that this will be an important part of the course and of your practice moving forward.